Welcome back to the channel. If you're new here, we focus on real, practical health information for adults over 60. No gimmicks, no miracle cures, just honest guidance backed by research that you can actually use. Today, we're tackling one of the biggest health concerns facing seniors in America. High blood pressure, also called hypertension, affects nearly 2 out of every 3 adults over the age of 60 in the United States. That's tens of millions of people walking around with elevated pressure in their arteries, and a staggering number of them either don't know it or they know but haven't been able to get it under control despite taking medication. And that second group, the folks who are on one pill, two pills, sometimes 3 or 4 different blood pressure medications and still can't seem to get those numbers where they need to be, that group tells us something important. It tells us we're missing something. We're treating the symptom, the high reading on the monitor, but we're not always addressing what's causing the pressure to climb in the first place. So let's fix that. Let's talk about what's really going on inside your body when blood pressure rises and what the science says about bringing it down naturally. Before we get into the hidden causes, let's make sure we're all on the same page about what blood pressure actually means. Because a lot of people hear those two numbers at the doctor's office, 130 over 85, 150 over 90, whatever it is, and they nod politely, but they're not entirely sure what those numbers represent. Think of your blood vessels like a garden hose. When your heart beats, it pushes blood through that hose. The force of that push against the walls of the hose, that's your blood pressure. The top number, called systolic pressure, measures the force when your heart squeezes and pushes blood out. The bottom number, diastolic pressure, measures the force between beats, when your heart relaxes and refills. A healthy reading is generally around 120 over 80 or below. When those numbers creep up, consistently, not just once on a stressful afternoon at the clinic, that means the blood is pushing too hard against your artery walls. Over time, that extra force damages the delicate lining inside those arteries. They get stiff, they get narrow. Tiny tears form, and plaque builds up in those tears like rust in an old pipe. That damage doesn't announce itself. There's no pain, no obvious symptom. You feel perfectly fine right up until the moment you don't. And that moment might be a stroke, a heart attack, kidney failure, or vision loss. That's why understanding the root cause matters so much. Catching the number is step 1. Figuring out why it's elevated, that's where real prevention lives. So here's where we get to the part that most people miss, and I want you to really pay attention to this section because it could genuinely change how you think about your health. When most people hear high blood pressure, their mind immediately goes to salt, eating too much sodium. And yes, sodium plays a role. We'll get to that. But sodium is a supporting actor in this story. The lead role belongs to something called chronic low-grade inflammation and arterial stiffness. These two things work together, and they are the primary engine driving high blood pressure in the majority of older adults. Let me explain what that means in plain language. As we age, the walls of our arteries naturally lose some of their flexibility. When you were 25, your arteries were soft and elastic, like a brand new rubber band. They could expand when blood surged through and snap back easily. By the time you reach 60, 65, 70, those artery walls have stiffened considerably. They don't stretch as well. They don't bounce back. That stiffness alone forces the heart to push harder to move the same amount of blood through your system. Harder push means higher pressure. Simple physics. Now here's the piece most people never hear about. That stiffening process isn't just a natural result of aging. It's dramatically accelerated by chronic inflammation, a constant, low-level state of immune activation happening inside your body that you cannot feel. Think of inflammation like a slow fire burning inside your blood vessels. You can't see the flames, you can't feel the heat, but it's there day after day, month after month, year after year, gradually damaging the inner lining of your arteries, making them stiffer, rougher, narrower. Your body responds by raising blood pressure to compensate, to force blood through vessels that are increasingly resistant to flow. And what causes this hidden inflammation? This is the critical question. Several things, and many of them are within your control. First, excess visceral fat. That's the fat stored deep inside your abdomen, around your organs. Unlike the fat just under your skin, visceral fat is metabolically active. It releases inflammatory chemicals directly into your bloodstream around the clock. You don't have to be significantly overweight for this to be a problem. Plenty of people who look relatively slim carry dangerous amounts of visceral fat around their midsection. If your waist measurement has been creeping up over the years, even if your overall weight hasn't changed dramatically, this could be affecting your blood pressure right now. Second, chronically elevated blood sugar. Even if you haven't been diagnosed with diabetes, blood sugar levels that ride on the higher end of normal, what doctors sometimes call prediabetes or insulin resistance, create a constant inflammatory response inside your arteries. Sugar molecules in the blood stick to the walls of your vessels and cause damage. This is incredibly common in adults over 60. Some estimates suggest that more than half of American seniors have some degree of insulin resistance without knowing it. Third, poor sleep. And I don't just mean not getting enough hours. Disrupted sleep, fragmented sleep, undiagnosed sleep apnea, these conditions trigger inflammatory pathways that directly impact your cardiovascular system. If you snore heavily, if you wake up feeling exhausted despite being in bed for 7 or 8 hours, if your partner has ever noticed you stop breathing during the night, this could be quietly driving your blood pressure up. Fourth, and this one surprises people, loneliness and chronic emotional stress. Research published in journals like the American Heart Association's own Hypertension Journal has shown that prolonged social isolation and unresolved psychological stress cause measurable increases in inflammatory markers in the blood. Your emotional life is not separate from your physical health. They are deeply biologically intertwined. So when we put all of these together, visceral fat releasing inflammatory chemicals, elevated blood sugar damaging artery walls, poor sleep disrupting your body's repair processes, and chronic stress keeping your nervous system in a constant state of alarm. What we get is a perfect storm. Arteries stiffen faster than they should. Inflammation keeps the damage cycle going. Blood pressure climbs. And a doctor looks at the reading, writes a prescription for a medication that forces the vessels open or reduces fluid volume, and sends you home. The medication may lower the number, but it hasn't touched the fire underneath. Let me ask you something. Does any of this sound familiar? Have you been on blood pressure medication for years, but never really understood why the pressure was high in the first place? If so, you're not alone, and please keep watching. Now let's talk about salt, because I promised we would, and because there's an important nuance here that gets lost in the usual advice. Sodium does affect blood pressure. That part is true. Sodium pulls water into your bloodstream, which increases the volume of fluid your heart has to pump, which raises pressure. For some people, this effect is quite significant. Researchers call these individuals salt sensitive, and roughly a third to half of people with high blood pressure fall into this category. Among African American seniors, that percentage is even higher. But here's what often gets overlooked. The problem for most people isn't the salt shaker sitting on the dinner table. The vast majority of excess sodium in the American diet, we're talking roughly 75%, comes from processed and packaged foods, canned soups, deli meats, frozen dinners, bread, condiments, restaurant meals. These are the real culprits. And here's the other half of the equation that almost nobody talks about: potassium. Potassium works as sodium's counterbalance in your body. It helps your kidneys flush out excess sodium and relaxes the walls of your blood vessels. Most American adults, especially seniors, are significantly deficient in potassium. The recommended daily intake is around 2,600 to 3,400 milligrams. The average American gets barely half of that. So the issue isn't simply eat less salt. The issue is that the ratio between sodium and potassium in your diet is wildly out of balance. Fix that ratio, reduce the processed food, increase the potassium-rich whole foods like bananas, sweet potatoes, spinach, beans, avocados, and plain yogurt. And many people see a meaningful improvement in their blood pressure without changing anything else. If you're over 60, or if you're caring for an elderly parent, spouse, or loved one, this information could genuinely be life-saving. High blood pressure is the single largest risk factor for stroke in older adults, and stroke is one of the leading causes of disability and death in this country. Understanding the real drivers, not just the surface-level advice, gives you power. Real power to make changes that matter. If you're finding this helpful, would you take a moment to hit that subscribe button? We put out new videos focused specifically on senior health every week, and subscribing makes sure you never miss one. It also helps this video reach more people who need to hear it. A small click from you could make a real difference for someone else. All right, let's get into the practical part. You understand the real causes now: chronic inflammation, arterial stiffness, sodium-potassium imbalance, visceral fat, blood sugar issues, poor sleep, and chronic stress. So, how do you address these things naturally? I want to walk you through 6 strategies that are supported by strong scientific evidence. These aren't replacements for your medication. Please don't stop taking anything your doctor has prescribed without talking to them first. But these are powerful tools that can work alongside your treatment, and in many cases, they can help you and your doctor reduce or even eliminate the need for medication over time. Strategy number 1: walk every single day. This is the single most impactful thing most seniors can do for their blood pressure, and it's free. I'm not talking about intense exercise. I'm not talking about jogging or lifting heavy weights. I'm talking about a brisk 30-minute walk most days of the week, walking at a pace where you can still hold a conversation but you're breathing a little harder than usual. A large analysis published in the European Journal of Preventive Cardiology looked at data from tens of thousands of participants and found that consistent moderate walking reduced systolic blood pressure by an average of 5 to 8 points. That's comparable to what some medications achieve. Walking reduces visceral fat. It improves insulin sensitivity. It lowers inflammatory markers. It improves sleep quality. It addresses multiple root causes simultaneously. If 30 minutes feels like too much right now, start with 10. Walk to the end of your street and back. Add a minute or two each week. The consistency matters far more than the duration. Strategy number 2: prioritize potassium-rich whole foods. We talked about this already, but let me give you a simple framework. Try to include at least one potassium-rich food at every meal. A banana sliced over your morning oatmeal, a handful of spinach tossed into your lunch soup, a baked sweet potato alongside your dinner, black beans stirred into a simple rice dish. These aren't exotic or expensive foods. They're available at any grocery store, and they make a measurable difference. At the same time, start reading labels on any packaged food you buy. Look at the sodium content per serving. If a single serving contains more than 600 milligrams, that's high. Start swapping those items for lower sodium versions or fresh alternatives. You don't have to be perfect. Progress beats perfection every single time. Strategy number 3: reduce added sugar and refined carbohydrates. Remember what we said about blood sugar and inflammation. Every time you eat a meal heavy in white bread, white rice, sugary cereal, pastries, sweetened drinks, or candy, your blood sugar spikes. That spike triggers an inflammatory response. Your arteries pay the price. This doesn't mean you can never enjoy something sweet again. What it means is that the foundation of your daily eating should be built on whole foods, vegetables, lean proteins, healthy fats, whole grains, legumes. When you do enjoy a treat, your body can handle it because the baseline is solid. Many seniors who shift toward this kind of eating pattern see blood pressure improvements within just a few weeks, often before any significant weight loss occurs. The inflammation comes down first. The numbers follow. Strategy number 4: address your sleep. This one is critical, and it's chronically overlooked in blood pressure management. If you snore loudly, if you gasp or choke during sleep, if you wake up with headaches, if you feel exhausted no matter how long you sleep, please mention these symptoms to your doctor and ask about a sleep study. Sleep apnea is extraordinarily common in older adults and is directly linked to resistant high blood pressure. Many people who've struggled for years to control their blood pressure with medication find that treating their sleep apnea finally brings the numbers down. Even if sleep apnea isn't an issue, basic sleep hygiene matters. Going to bed and waking up at roughly the same time each day, keeping the bedroom cool and dark, avoiding screens for an hour before bed, limiting caffeine after noon. These small adjustments help your body enter the deep, restorative sleep phases where blood vessels relax, inflammation decreases, and repair happens. Strategy number 5. Practice slow, deliberate breathing. This might sound too simple to be effective, but the research behind it is remarkably strong. A technique called slow diaphragmatic breathing, where you breathe in slowly through your nose for about 4 to 5 seconds, then breathe out slowly through your mouth for 6 to 7 seconds, activates your parasympathetic nervous system. That's the branch of your nervous system responsible for calming things down. It directly reduces the stress hormones that constrict blood vessels and raise blood pressure. Studies have shown that practicing this type of breathing for just 10 to 15 minutes a day can lower systolic blood pressure by 4 to 6 points over several weeks. There's even an FDA-cleared device called Respirate that guides you through this breathing pattern, though you certainly don't need to buy a device. You can do it sitting in a comfortable chair with your eyes closed, counting the seconds on each breath. Morning and evening, 10 minutes each session. Your body responds quickly to this kind of consistent practice. Strategy number 6. Nurture your social connections. I know this doesn't sound like typical blood pressure advice, but remember what we discussed about loneliness and chronic stress driving inflammation. Human beings are wired for connection. When we lose that connection, through retirement, the loss of a spouse, children moving far away, friends passing on, our nervous system registers it as a threat, and our stress response stays elevated. Find ways to stay connected. Call a friend or family member regularly. Join a walking group at your local community center. Volunteer somewhere. Attend a weekly class. Painting, cooking, book discussion, anything that puts you in a room with other people on a regular basis. If mobility is limited, even regular video calls with family members have been shown to reduce feelings of isolation and lower stress hormones. Your heart doesn't just pump blood, it responds to how you feel. Protecting your emotional health is protecting your cardiovascular health. They are the same thing. Now, I want to be clear about something important. Natural strategies are powerful and they address root causes in ways that medication alone often cannot. But they are not a substitute for medical supervision, especially if your blood pressure is significantly elevated. If your readings are consistently above 160/100, or if you experience sudden symptoms like severe headache, chest pain, blurred vision, difficulty speaking, or numbness on one side of your body, that is a medical emergency. Call 911 immediately. For everyone else, the best approach is a partnership between you and your doctor. Bring this information to your next appointment. Ask about your inflammatory markers, specifically a test called C-reactive protein or CRP. Ask about your fasting blood sugar and your hemoglobin A1C, which shows your average blood sugar over 3 months. Ask about a sleep study if you have any of the symptoms we discussed, and tell your doctor about the lifestyle changes you're making. A good physician will be your ally in this process, adjusting medications as your body responds to the real, foundational changes you're putting in place. Let's bring this all together. High blood pressure in older adults is not simply a salt problem. It's not just a stress problem. At its core, it's driven by chronic low-grade inflammation, arterial stiffness, metabolic imbalances, poor sleep, and the accumulated wear of decades of modern living. These are the real causes. And while medication has its place, addressing these root issues through daily movement, whole food nutrition rich in potassium, blood sugar management, restorative sleep, deliberate breathing, and genuine human connection. These are the strategies that change the trajectory of your health in a lasting way. You are not powerless in this. That's the most important thing I want you to take away from today's video. Every single day, you make choices. What you eat, whether you walk, how you breathe, who you talk to, and those choices add up. They compound. Small, steady, consistent actions become the foundation that medication alone could never build. You've lived 60, 70, 80 years or more. You've earned every single one of those years, and you deserve to live the ones ahead of you with energy, with clarity, with a heart that beats strong and steady. That's not a fantasy. That's a realistic outcome when you understand what's really going on inside your body and take thoughtful, informed action. If this video helped you understand something about your blood pressure that you didn't know before, please hit that like button. It sounds small, but it tells the algorithm to show this video to more seniors and caregivers who need it. Subscribe to the channel if you haven't already. We release new senior health videos every single week, and each one is designed to give you clear, actionable information you can trust. Share this video with a spouse, a sibling, a friend, or an adult child who worries about your health. Sometimes the people who love us need to hear this information too. And drop a comment below. Tell me, what's one change from today's video that you're going to try this week? I read every single comment and I'd love to hear from you. Take good care of yourself. You're worth it. I'll see you in the next one.